Okay, so I have a presentation to do on epilepsy for class. I thought I would do a run through on the channel. Normally I wouldn't do this, but I think it's good, nice walkthrough. So I'm doing a presentation on epilepsy and ethnopharmacology. Ethnopharmacology for the layperson is the analysis of like more nutraceuticals and different cultures and how they treat different disease states with natural medicines mostly. So I'm going to run through, we're going to go through the pathology of the disease, then the main therapies and their mechanisms, and then the main herbals, how they're prepared, active ingredients, their mechanism of action, if they have any drug interactions, and any official medications that have been derived from it. And then I'm going to add the main herbals to be avoided, and then other treatments that are not drug therapy for epilepsy. So, the clinical definition of epilepsy is at least two unprovoked seizures occurring more than 24 hours apart, or one unprovoked and the probability of one happening later, and a diagnosis of epilepsy syndrome. So basically, if you have no seizures for about 10 years or any seizures without medication for 5 years, that usually means that the epilepsy is resolved. The reason this is important is because there are different types of seizure epilepsies, sorry, not seizures. There are different types of seizures, but there are different types of epilepsy. And generally, the ones in children, people grow out of them. And then as they go to being an adult, they don't have it. So that time period is important to note that. So there's many different types of seizures. There's focal, which is usually on one side of the hemisphere. People sometimes can even talk. They're pretty lucid when they have those. You have complex, which can be mixed. Generalized, generally they can't talk. It's going over their whole entire brain. The clonic and the tonic. So myoclonic and clonic, as I can tell, it's how they stretch or bend in, and it's like a rigidness, whereas the tonic is a shaking. And the atonic is they lose like all muscle tone, and that's why they just like all their muscles go limp. It's like the Vulcan death grip. And the unclassified, it's really a misnomer. It actually is just uh, neonates and very small children that have it, and you can't figure out what they have because they're just so tiny. You really, that's as far as what I can tell. That's why they're called unclassified. So the kind that causes the chronic epilepsy is your brain injury, your stroke, brain tumors, infection. There seems to be, when I was looking this up, the majority of genetic seems to be like a new 1 point mutation in a person. But if they have kids, it seems to that inherits about 25% of the time. So there seems to be a genetic component, but usually it can be a de novo, 1 point mutation. And then there seems to be, there's just so many different genetics problems can happen that and you'll see why later in the pathology that that's the reason. And then there's possibly birth defects that cause these as well. The other causes are more, we know the cause really well. So alcohol withdrawal, that's why I have the delirium tremens, which is a good Belgian ale. Uh, delirium tremens is what it's called when you have the seizures and the shaking when you come off of alcohol. And then electrolyte issues. So you'll see later like hyponatremia, hypernatremia can cause seizures. Refeeding syndrome, that is usually when you give a total parenteral nutrition to a patient, they will sometimes dump lots of potassium into their system because they haven't had the nutrients, and it causes a huge electrolyte imbalance. Anorexia bulimia is kind of the same way, that they go without food for so long, or they throw up so much that they deprive themselves of the chloride ions, or in anorexia, they just don't have enough food and they basically get refeeding syndrome. Febrile seizures is the kind of seizures that come about from fevers and generally happen in children under 5. And of those children with seizures, 1 to 2% of them end up developing into full on epilepsy later on. So, this is an EEG, which is shows kind of the brainwave patterns. And so, the big hallmark of epilepsy is the brain goes from kind of like random sporadic uh, waves to it gets synchronous all at the same time. So your brain's all the nerves aren't supposed to fire at once. They're communicating to each other. So one needs to talk to the other. And essentially, when they fire it all at once, it's like having a whole room of people shouting at the same time. Sometimes you need that, but not necessarily like this. So that's one of the problems with epilepsy, is that all the nerves just go off at once and then they keep going off. They keep replaying and hitting off of each other and keeping that wave going. So this is the pathology, and this is kind of the big uh, diagram that how the seizures develop. So there's a stimulus that happens on the outside of the cell that causes a calcium influx, and it causes the depolarization of the neuron that opens up the sodium channels. Sodium flows in, the action potential is reached. Um, the axon is then stimulated, and then there's calcium influx, which helps release the neurotransmitters. So you have gamma something butyl acid. I'll have to look at which one, but it's GABA, and GABA generally inhibits seizures. It's a when there's lots of GABA, it decreases the likelihood of seizures, whereas glutamate and aspartate, they help continue those cyclical seizures, kind of like um, the best way I can explain it in like a visual way is when you have like a mattress and you slam your hand into the mattress, you kind of see a wave, but it just stops right away. And that's kind of like GABA. Whereas the glutamate aspartate would be like you slam your hand into a pool of water and the waves go and then they hit off the back of the pool and they come back and they go back and forth. And they just keep going because the material itself keeps propagating those waves. And that's kind of how those two work in a very layman term. And so the potassium channels open and the sodium channels close. And so the potassium comes in and the neuron gets hyperpolarized and then it resets so it can be repolarized. So this is the main therapy groups that we have. So you don't need to know all the names, but you do need to know that it inhibits the sodium and inhibits the calcium. It increases GABA activity and then inhibits the glutamate. And then there's the novel therapeutic agents and the broad spectrum agents, I believe, uh, act all over the place. So, our the main herbals, the main 3 that I'm gonna look at is, cannabidiol, which is derived from marijuana, and the reason I'm not looking at marijuana and cannabidiol is that when I looked at the chart from the alternative therapies book, For epilepsy, which is kind of like, I guess, the handbook for this, they had them as two separate things. So they're considered two separate agents, evidently, according to them. And they believe that one helps and the other one doesn't. So they believe cannabidiol helps, marijuana doesn't. Valerian root, and then skullcap. And that's not the right skullcap. It's the skullcap that is Chinese. The reason I put this picture of skullcap is because you can very clearly see the little kind of skull-looking front. So with cannabidiol, it's mostly extracted from the hemp, and there's three different versions that seem to be the main versions. There's cannabis indica, cannabis ACDC, and cannabis Charlotte's Web. Charlotte's Web is actually interesting because there was a documentary, and this is how I first got interested in this because I don't know enough about epilepsy, and I didn't know the amount of resistance to drugs. Um, so about 1 in 3 people have problems with their drugs. They either have it takes them a long time to get there. So Charlotte is a little girl that by the age of 3, I believe she had had over 300 different seizures. So when you break that down, that's about a seizure every other day to every third day, which would be terrifying as a parent. And she was non-functional, and her parents had gone through every single therapy in the book, and she had a very severe version of epilepsy called Lennox-Gastaut syndrome, and that seemed to work. Now we have a new drug that is the CBD oil. It's a Pidolex, and it's considered a Schedule 5, but you have to have a prescription, and it costs $32,000 without um, insurance. With insurance, I believe that they have coupons and discounts, so it comes down to being like 50 or 100 because it has an agreement. The reason it's so expensive is that they had to go through so many hoops and legal problems, and the federal government still kind of goes after them. So that's as far as why I believe it's so expensive. Um, but it has a multi-facet way of uh, working. Is that it modulates the calcium channels. It inhibits the GABA channels. But there's non-benzodiazepine channels and there's benzodiazepine channels. And I believe it goes after the non-benzos. It modulates serotonin. I don't know if that really doesn't go into the pathology of um, epilepsy, but it will make a patient feel better because a lot of these drugs depress, and so there are some patients that get depression. So this might actually help them not have depression. And it reduces the glycine and adenosine. The dosing, because it's for children, I believe you can only get it if you're like under 12. So unfortunately, it's not one that, a bunch of college kids are going to be, yeah, let's do some cannabidiol. Originally, actually, it was called Hippie's Disappointment was the name of the strain because you can't get high off of this. Um, I found that funny when I was reading this up. The adverse drug reaction is that because these are high lipids, they can cause liver toxicity because, and this is why they recommend cannabidiol and not marijuana. Marijuana has so many interactions with all the other drugs. So if you're taking any other drugs or you just can't really get to a stable dosing with it. Whereas with the pure oil, you can actually get kind of a stable dosing. And you can find Charlotte's Web oil, I believe for like $100, 135, I believe I saw it on Google this morning. And then there are some children that they just can't stomach it, and I don't know why. But that is something that they listed, that some children get nausea and vomiting. But Lennox-Gastaut and is a separate syndrome from Dravet syndrome. So just letting you know that I just put the two of them together, but they are two separate syndromes, but they're both. This is what supposedly it works, and that is the molecular structure of cannabidiol. So the arrows point to where it works at. Valeriana officinalis. It was first recognized in 1592 to reduce seizures. It was written about. Um, its prodrug, isovaleramide, seems to be what is looked at. And so what happens is that you need such a high dose of isovaleric acid or valeric acid that you can't get to that point. But you can give the prodrug, which prodrug just means it is a drug that your body metabolizes to the drug. So that seems to be investigated. It's currently it started in 2004, as far as I could tell. So it takes about 20 years to 30 years for these drugs to come out. So we're gonna maybe see it in 2024 or 2034. Um, The mechanism is it increases the effect on GABA. And so I have with the nitrogen on it, that is GABA, and then the I think no, that's valeric acid, is the one on top. And so I expanded them out so you can very clearly see they're very, very similar. And so the dosing I found was that it's 200 milligrams up to 3 times a day, and you have to titrate it. However, if you go above that dosage, it causes somnolescence, which means that it will just make you sleepy and make you fall asleep, because that's the other use for valerian. It seems to have a lot of interactions with other drugs. It also has liver toxicity as well. So these are the other active ingredients that I saw that were in it. There seems to be GABA in it already, which might also be one of the issues, but um, these are all possible reasons why it's working. However, when I was looking in the alternative therapies book, it seemed to very much say that it was the isovaleric acid. So, and that's where it works. So then we have skullcap, which was recognized, I believe, back in the 800s and was considered one of the 50 fundamental Chinese herbs. So there's a lot of uh, Chinese medicine that has it. And this one, you can't really see the little skull in it, but it is skullcap. And that is the official one. And there are about 50 different versions of skullcap. So you have to look for the scientific name. This is the Chinese herb version of skullcap. And it has about seven active ingredients. We're not quite sure which one works on it, but one of these ones all particularly bind to the GABA A channels, and it doesn't distinguish between the non-benzodiazepine and the benzodiazepine channels. And it seems that you can take up to 500 milligrams a day. However, because it's epilepsy, it has to be titrated. So they suggest starting at 100. Um, the one issue that both skullcap and marijuana have is that they both cause effects on insulin or act as insulin. And so your body's, if you had diabetes, we would not recommend you to take this. Um, CBD oil, probably you shouldn't take it if you have diabetes either. So that would just leave you with valerian to take. And it looks like the molecular structure, as far as I can tell, um, looks like a lot of these look like steroid hormones, and so there seems to be problems with it acting on people's fertility, or they cannot get a stiffy, as to put it very politely. So that is one of the problems with it. So that's where that works, and that works almost exactly like valerian. So these are herbals to avoid. Ginkgo, St. John's wort, marijuana. It's not so much the active CBD on marijuana, it's all the other stuff. It's all the other stuff causes interactions. So it just causes your cytochrome P450s to go out of control. And then you don't get any benefits anyway. And that will cause increase in neurons and stuff firing off, which you don't want in seizures or epilepsy because it'll cause seizures. Ginseng, they put in a lot of caffeine drinks. So it's something that's supposed to keep you awake and increase neuron firing. So it increases seizure incidences. Kava is the same way. Passion flower, it seems that it just has mostly interactions. However, it is used for sedating people. So it could work in epilepsy, but there's no clinical data. So, um, and then chamomile, it interacts with the medication, not necessarily the disease state. And caffeine, ephedra, they interact with the disease state. Mint tea has, on one database, I found that it had interactions. In another database, it said that it caused sedation and another. So I'm not quite sure, but both of them said mint tea was an interactive. So I'm not sure why. Um, the other treatments is surgery. They use a laser. And they use MRI laser ablation. So they go in, drill a very small hole, have the person awake, and they obliterate the part of the brain that is causing the seizures. And then there's vagus nerve stimulation, which is basically they put in the little electrode, and if I remember correctly, it just to keep the brain from firing off at the same time. So it disrupts everything and keeps the nerves from kind of going haywire. The ketogenic diet. So there is a correlation with omega-3 fatty acids and the reducing of seizures, but the ketogenic diet seems to reduce seizures as well. So that's recommended. I couldn't quite understand what the mechanism was for that, but I assume that it is just that you don't have as much change in your blood sugar and you're changing your electrolytes, and that probably reduces the amount of seizures. There are vitamins and supplements, B6, magnesium, vitamin E, folate. These seem to help with reducing seizures. So this YouTube video, it is a link to my dog. So my dog is he had had a seizure when we were at home at Christmas time, and we were concerned. So I had taken a video, and so he can't. At the time, he was flexing his feet. And you can kind of see that. You can see that he's shaking. Um, and most people they're incontinent or they lose control, and so you can clearly see all of he's drooling all over himself. Um, and what happened right before this, which was scary, was that he ran straight into a wall and like cracked his head into the door. And then he got up and did it again and again. And that's what dogs do when they have seizures. But that is it for this. And then these are all the stuff that I got it from the alternative therapies for epilepsy. That's what I pulled. There's about probably about 100 different natural medicines in there. This isn't everything. There's more stuff. And I closed down my laptop and I lost about half of them because that was the last thing I did. So unfortunately, but usually I have better citations, so I'm a bit disappointed in myself. Anyway, that is the presentation on epilepsy that I'm doing today. And I'm running about 10 minutes over, so I have to make this presentation go a lot faster when I do it for class. But this is the full thing. So let me stop the broadcast. I'll see you guys later. I won't be doing another presentation for a while.